The Trump administration's executive orders between 2025 and 2028 sparked widespread debate, legal challenges, and tangible harm to vulnerable communities. While framed as efforts to strengthen national security, reduce costs, or promote economic independence, several policies disproportionately affected low-income families, immigrants, and marginalized groups. Below is an analysis of 5 such orders, their stated goals, and their real-world consequences. In January 2025, Trump revoked Biden-era initiatives that capped insulin at $35 per month and limited Medicare drug costs to $2 for generics. The administration also rolled back ACA enrollment expansions and subsidies, arguing these measures inflated bureaucracy and stifled market competition. The immediate fallout was stark. Seniors and low-income patients faced sudden price hikes for life-saving medications. For example, insulin costs quadrupled overnight for many diabetics, forcing some to ration doses, a dangerous practice linked to hospitalizations and deaths. Meanwhile, ACA rollbacks jeopardized coverage for 24 million Americans, particularly those with pre-existing conditions like cancer or diabetes. Rural clinics, already struggling with funding shortages, reported a 30% drop in patient visits as families avoided unaffordable care. Public health experts warned the moves would reverse a decade of progress in reducing uninsured rates, disproportionately harming Black and Latino communities, who comprise 40% of ACA enrollees. 2025 order denied automatic citizenship to children born in the U.S. if one parent lacked legal status, directly challenging the 14th Amendment's guarantee of birthright citizenship. The administration claimed this would deter anchor babies and reduce undocumented immigration. In practice, it created a subclass of stateless infants unable to access passports, social security benefits, or public education. Hospitals in border states like Texas and California faced chaos, as staff scrambled to verify parents' immigration statuses before issuing birth certificates. Over 50,000 children were effectively undocumented despite being born on U.S. soil, according to the Migration Policy Institute. Legal challenges temporarily blocked the order, but the chilling effect persisted. Mixed-status families avoided prenatal care and vaccinations, fearing deportation. Pediatricians reported a 25% rise in preventable childhood illnesses in migrant communities, while schools struggled to enroll children without documentation. Invoking the National Emergencies Act, Trump deployed 15,000 troops to the southern border in 2025, diverting $3.8 billion from FEMA disaster relief and National Guard programs. The order suspended asylum processing and authorized military involvement in detaining migrants, including families. Critics argued this militarization worsened humanitarian conditions. Over 2,000 children were separated from parents, echoing the 2018 family separation crisis. At least 18 migrants died in custody due to overcrowded facilities and inadequate medical care, per Human Rights Watch. Domestically, the diversion of FEMA funds delayed disaster responses to wildfires in California and hurricanes in Florida, leaving thousands without aid. Border communities also suffered economically. Trade with Mexico dropped by $12 billion as checkpoints slowed commercial traffic, and local businesses reliant on cross-border shoppers reported 40% revenue losses. A January 2025 directive froze $400 billion in federal grants, including Medicaid, Head Start, and Section 8 housing vouchers, citing wasteful spending. The order blindsided states and nonprofits. Medicaid payments to hospitals stalled, forcing some clinics to reduce services or close. 30% of residents rely on Medicaid. Opioid treatment programs turned away thousands. Homeless shelters in cities like Chicago and Los Angeles faced immediate funding shortfalls, with 200 facilities closing within 6 months. The freeze also halted WIC nutrition assistance for 6 million low-income mothers and children, sparking a 15% rise in infant malnutrition cases in Texas alone. Legal injunctions partially reversed the order, but the damage lingered. Nonprofits laid off 120,000 social workers, and food banks reported a 50% surge in demand. Trump's Patriotic Education Executive Order terminated federal diversity, equity, and inclusion (DEI) initiatives, including the HUD's Fair Housing Rule. The administration claimed these programs promoted divisive ideologies, but their removal had concrete repercussions. Landlords in states like Georgia and Ohio began rejecting Section 8 voucher holders, disproportionately affecting Black renters, while LGBTQ+ shelters lost federal funding, forcing many to shut down. Workplace discrimination complaints surged by 45% as federal contractors abandoned equity hiring practices. The rollback of environmental justice policies also hit communities of color hardest. Permits for toxic waste facilities in majority black counties increased by 60%, per the EPA. Meanwhile, the termination of the Gender Policy Council erased protections for transgender individuals in homeless shelters, leading to a documented rise in violence against LGBTQ+ youth. These orders prioritized ideological agendas over public welfare, exacerbating inequality and destabilizing critical systems. While courts blocked some measures, like the birthright citizenship order, the harm to marginalized communities persisted. Families avoided medical care, children grew up stateless, and low-income households faced eviction or hunger. Economically, the policies backfired. Hospital bankruptcies rose, border trade suffered, and workforce diversity stagnated. As legal scholar Emily Tucker noted, executive power can enact changes swiftly, but the human toll of these experiments lasts generations. The Trump era underscored a stark lesson. Policies framed as cost-saving or patriotic often exact their highest price from those least equipped to pay.